menopause or the cessation of a girl's ability to reproduce is not a disease.
So what's the most critical signs of pregnancy that you've come across which expecting mother should know?
So across the 9 months of pregnancy, if a lady during pregnancy has bleeding, she has to reach the hospital. She has to contact a gynecologist and reach hospital. There's so many restrictions put earlier days when we were doing what is known as a classical cesarean section. So that's gone. So nowadays, if we have a cesarean section, the patient is up and out next morning. She's eating food. She's feeding a baby.
So what's something you wish teenagers know about menstruation and reproductive health?
Every girl should be maintaining a menstrual diary. Patients' husbands being with me through the delivery process, and it's always fun to, it's enjoyable to watch the husband's reaction when he sees his child being born for the first time. I get this question a lot, can I exercise in pregnancy? So what I ask my patients to do is, you do all your exercises before you get pregnant.
Welcoming you all to the Poster Show, where real conversations meet real expertise. Today, we are going to talk about a topic which is very important to every woman, but still wrapped in whispers. That is reproductive health. Our guest, Dr. DEEPAK Shedde, who is a leading gynecologist and an advocate to women's health, is going to debunk the myths and also tell us some untold truths. So let's get started. Welcoming you, sir.
Thank you.
Sir, could you tell us a little about your background? What inspired you to become a gynecologist?
So I was actually never really interested to be a doctor when I was a young child. I was more engineering inclined. But somewhere, I think in my 12th standard, I decided I'll start looking at healthcare. So once I got my MBBS seat, I like all doctors, young doctors, we all look at neurosurgery, cardiac surgery, all the fancy specialities. So I was probably looking at those areas. But in my college where I studied, we were supposed to conduct deliveries during our MBBS. We actually had to conduct 20 deliveries. And we were posted in our labor room till we complete 20 deliveries. It was a day and night posting. And so I read all this stuff about childbirth, everything. And I attended my first day at the labor room. And that first delivery I saw, I can still close my eyes and remember it. The first delivery where I saw a newborn baby coming into this world. And more importantly, the face of the mother, the joy, the relief, the pride. It was such a mixture of emotions and thrill. That was a time I knew, that is my second year MBBS, I knew, okay, this is what I wanted to do for the rest of my life. And that's from then onwards, I more or less stuck to obstetrics as the area of my interest.
So how is it different from the other streams of medicine, emotionally and mentally?
So specifically when it comes to obstetrics, that is the management of pregnancy, a family trusts a doctor to take their daughter or their wife through a journey which is potentially fraught with a lot of dangers, and it's a huge responsibility when parents bring their daughter or when they come to us. It's an honor. I mean, my patients honor me by coming to me and trusting me so much to take their family members through this journey. It's a privilege, but there's a huge amount of responsibility which comes with the job. And a lot of emotion. There's a huge societal expectations from obstetricians nowadays that people expect that every delivery should be successful, every pregnancy should translate into a baby, when nature often doesn't have that plan. So yeah, there's a lot of pressure on us, a lot of emotional turmoil sometimes. But it's in one of those most rewarding fields. I don't think I could think of doing anything except this field. It is just one of those amazing fields we can think about.
So what's the most common thing that you've come across people misunderstand about gynecologists?
So whenever you go to a doctor and you complain of pain, the first answer a doctor is going to tell you is like, oh, you have pain, I'll take care of that, I'll decrease your pain. Whereas we are a different breed, so if a girl in labor tells me, doctor, I have pain, I would probably tell her that good, it's good, that pain you have in labor is good, and the more pain is better. So this goes totally opposite of what a doctor is supposed to be. I mean, we're supposed to make you more comfortable, less pain, but here when the pain actually is good in its own way. I mean, we have wonderful ways to decrease the amount of pain a girl have during labor. We have epidurals, we have injections, we have some types of gas we can give. But generally, the pain a girl suffers during pregnancy, delivery, childbirth is we doctors would consider it, gynecologists would consider it to be a positive thing, and that's how people often think as obstetricians to be probably a bit cruel, though we are not. We are not cruel, but nowadays, of course, it's changed. I mean, most of us doctors of our present generation are more empathetic to patients' needs and their pain perceptions. Often, just being with a girl during her labor, doctors, if you can just stay with the patient, just the fact that you're there by their side often decreases the pain a lot.
So, at what age young women should actually start visiting a gynecologist and why?
So earlier the better. Actually, reproductive health education now is included in most schools, and though I strongly feel this education should start at home by the parents, by the mother and the father, but nevertheless, schools do have a reasonable amount of reproductive health education now, but it's not really as clear often. It's there's a lot of facts which are hidden, which in a one-to-one basis, a doctor like me, a gynecologist, if I go to talk to a parent, a mother and her daughter very early, we probably would be able to do a more complete job, tell them, educate them on everything, clear doubts. So having a young girl around puberty, or even before puberty, even boys pre-puberty, around puberty, would be probably very, very helpful for them. So yeah, earlier the better. A little bit of reproductive health education before they start their periods would be helpful, and yeah, sometimes we doctors probably will be able to do a better job than most, but ultimately it has to start with the family.
And talking about puberty, these days we see that young girls are actually maturing very early. Why is that happening?
So across the world, there has been a slight drop in the age at which girls are starting off with puberty. Not much, and it's not standard. Like, I mean, it's just a percentage of girls who have earlier puberty is definitely on the rise. We do see this particular this type of phenotype, or the type of girls who have periods early, in areas where there's a little bit excess nutrition. Maybe obesity, childhood obesity, maybe a lot of foods which we would rather not give children, like high carbohydrate based foods, processed foods. So these are the areas where we need to take care of, and probably is really important. But it could be just nature, and nature is always changing. Over a period of time, things change, and so evolution is persistently, constantly changing the way we are. So it may be that as well. So is it a problem? No, it's not a problem. So one thing we need to be clear about: if a girl attains puberty little earlier, there's a lot of panic. You don't need to be panicked. Just bring the girl to the hospital, to a doctor, to your gynecologist, and they will investigate to see whether we need to be a bit concerned about. There is something called precocious puberty, where we would need to do some tests, but there's no need to panic. It's manageable, and there's no long-term consequences.
So, what's your view on contraceptive pills and how dangerous are they?
So contraceptive pills are hormonal tablets. They contain two elements of two types of hormones, estrogens and progesterones, and it mimics the way our body hormones are presented. So our body has got women's bodies has two hormones, estrogen and progesterone, and each one acts and counteracts the other. So it's like a brake and an accelerator. And so these pills, oral contraceptive pills which are available, they contain both. So there's an element of safety inbuilt in those pills, which allows us to safely give a person those oral contraceptive pills. We have strict guidelines on who can take, who should take, when we should stop, how long we can give, and we have WHO criteria for giving oral contraceptive pills. And if they fall into the category like they're diabetes, they're not well controlled, if they're hypertension, again not well controlled, people who are obese are not very good candidate for pills, people who have clotting tendency, we have standard criteria where we should not give. But if a lady fits into the that criteria of giving, we can safely give oral contraceptive pills, they're actually quite good. The problem here is we always would like to distinguish between the over-the-counter morning after pill from the oral contraceptive pills, which are different. So the oral contraceptive pills, which contain as a 21 or a 24, 28 day packet taken on a daily basis, is relatively safe. The other tablet which is commonly used nowadays, which is the morning after pill, that's unbalanced. It contains a large dose of one particular hormone. Now that tablet was designed as an emergency contraception. And I know couples who are taking it pretty often, and if something is happening once or twice a month, it's not an emergency, and so the tablet was never designed for this type of use. So that's something I would be very nervous about telling people to take. It's an emergency, and emergency should happen once in your lifetime. So that's safe in its own right, but the oral pills, that is the 21-day packet, the E plus P, what we call, are actually pretty safe, provided we follow the correct guidelines.
So you've been a part of so many childbirths. Which was your most memorable moment?
So the first one, I can just close my eyes and remember the first childbirth I saw, and that still gives me goosebumps, and of course the delivery of my two children. I was lucky enough privileged to be instrumental in and present for the delivery of my two children, so those would be also very important.
What happens to a person's body during perimenopause?
So menopause is a transition. So we call it the perimenopausal transition, where a lady's body, which was used to nearly 30-35 years of estrogen, now is getting used to the fact that her estrogen level is decreasing. Now, it's not a disease. So one thing we have to be very clear and make it clear to everyone is that menopause, or the cessation of a girl's ability to reproduce, is not a disease. It's nature, it's natural, and women across the world for the last 40,000 years of Homo sapiens have been having menopause, and it's not a disease. It's a change, and our human body does not like change. And so our body which was used to estrogen, now has to undo that use. It's like a drug addict getting used to no drugs, or an alcoholic being made to stop alcohol. There's an element of change which the body doesn't like. And so there's a physical change, there's a mental change, and this is the time when it happens around 45, 55. So there are a lot of things happening at that age group, the girls, the ladies, children are probably just leaving home. They're all teenagers. They're probably leaving home. So there's an empty nest syndrome which comes along with that. Their husband probably would be retiring. So there's a drop in income. So all those things put together, the overall social concern as well as the fact that our body is changing, makes menopause a bit of a difficult time for women to go through. But I would look at it differently. This is the best time in one's life. Menopause period is the best time in one's life, because first 20 years she was education, next 20 years she was reproduction and taking care of children. You've done all that stuff. Now you can actually do the things you always wanted to do. And I have a lot of my patients I've seen who are in plus 45, 50, who are actually starting new businesses, starting new hobbies, and actually having the time of their life. So I don't think menopause should be considered to be a disease in any way.
So what's the most critical signs of pregnancy that you've come across which expecting mother should know?
So across the 9 months of pregnancy, if a lady during pregnancy has bleeding, she has to reach the hospital. She has to contact a gynecologist and reach hospital. So bleeding of any type, any color, any distinction has to reach hospital. So bleeding across the 9 months of pregnancy. In the last 3 months of pregnancy, there is a condition known as preeclampsia, wherein the patient's blood pressure may go up, and it's quite common actually. Now, once the blood pressure goes up, there's a potential for that lady to have fits. We call it eclampsia, wherein the girl would throw a convulsion. Now, before she has a convulsion, there would be some warning signs. So that would be like some flashing or blackouts in her eyes. She could be having nausea, vomiting. She would have severe headaches. So around 8 months, 9 months, if a lady has having those symptoms, she really needs to meet a doctor very quickly and reach hospital early.
Do you believe that C-sections are rising unnecessarily, or is it justified?
So cesarean sections are definitely rising, and there's no doubt about that. Is it unnecessary? So that's debatable. Okay, we look at childbirth from a pure safety point of view. So a lot of patients do come and ask me, we heard that you deliver your babies more naturally than otherwise. Other doctors do cesareans more, and I disagree with that. Everyone, every gynecologist would like to deliver their mothers safely, and that's the whole and soul and only parameter we have. So for that particular mother, at that particular time, for that particular mother and baby, which was the safest route out? And if that safest route out was a cesarean section, I think that's the right way to do it. And there should not be any questions on why. The beauty of cesarean sections nowadays is that the consequences are very low. For example, long back when cesareans were done, it usually meant she could not have any more children. It usually meant she could not perform her normal activities. She would be on bed rest for so long. There's so many restrictions put earlier days when we were doing what is known as a classical cesarean section. So that's gone. So nowadays, if we have a cesarean section, the patient is up and out next morning. She's eating food. She's feeding a baby. If you go to a lady's room after cesarean section and you don't tell her that tell the family members she had a cesarean section, no one would know. And consequences that she should not have any more children, or you should not do that, nothing. So we don't give any restrictions on an average, different that of a girl who's delivered naturally. So the safety of cesarean sections, the technique we use, the suture materials which are used nowadays, we don't even put stitches nowadays, and we don't have to remove any sutures and all that stuff. So it's become that much more comfortable. Just because it's comfortable, and just because it is relatively safe, doesn't mean it should be the best way. So we don't want any conveniences to come into that. Like patients don't want to deliver naturally because it's painful. I don't believe that's a reason for a cesarean section. She should go through natural labor. We'll give you something for the pain. We have very good stuff for the pain. So that's all we need to look at. Is it safe? Which is safer at that particular moment? And go for a section if it is safer, or go for a vaginal delivery or a natural delivery process. And that can change. I mean, a lady we would expect to deliver naturally may suddenly land up needing a cesarean if the baby's heartbeat drops or baby passes through or something like that. And vice versa. I have seen patients where I have decided, okay, you probably will require a cesarean section, and they land up delivering naturally. So both could happen.
So what should every expecting couple know in their first trimester?
So first trimester is the most challenging time for any couple when they get pregnant. A lot of unknowns, a lot of advice from every Tom, Dick and Harry. Everyone's personal experience becomes the whole truth, nothing but the truth situation. So actually they just need to come to a responsible gynecologist and clear all their doubts, and usually it's done there. But the first trimester is a time when the body is changing. See, again, I told that body doesn't like change. So when a girl gets pregnant, her body is changing, adapting to carry a baby through. It's a huge change in her body. Though she is designed for this, her primary reproductive functions is innately natural, right? So it's not like she's doing something unnatural. It's the most natural thing, actually. But it's a change, and the body doesn't like it. So she's going to have all nausea. She's going to have food changes. She's going to have some kind of stress, mental changes, moodiness, puffiness. All that stuff is going to come in play. Needing to go to the washroom often, little bit of constipation may be there. The mental stress of, is my pregnancy going to be healthy or not, and the 9 months stress of the 9 months coming 9 months, and then afterwards delivery, children, breastfeeding, school, everything comes in place. So there's a lot of mental pressure when a lady gets pregnant for the first time, but it's an amazing journey, right? So so the doctor and the family rally around and help her through. It's pretty good. It's actually it's quite a lot of fun.
So, what's something you wish teenagers know about menstruation and reproductive health?
So in one line, it's menstrual diary. Every girl should be maintaining a menstrual diary, and what we mean by menstrual diary is she should track and write down when her periods come, how many days of flow she has, how much of bleeding she has per day, and any other symptom along with that. So, if this menstrual diary, if a lady is able to keep right from scratch, that is right from puberty all the way through her life till she attains menopause, this is basically a window into her health. And it gives us a clear-cut idea. If you just go to your doctor and you give your doctor a menstrual diary, within a couple of glances, we'll know exactly what's happening. Because often we don't realize the changes if we don't document it. So having a menstrual diary would be probably the most important thing a lady needs to keep right from scratch. And we now recommend girls keep it. In non-educated scenarios where girls are come from very low educational backgrounds, we even have beads. We use beads, red beads, white beads, so that they can keep a menstrual calendar. It gives you control on your fertility. It gives you an idea when the next period will come. It keeps you prepared. If you feel that the number of days of bleeding was 5 days, now it's become 7 days, maybe you should see a doctor. If you feel the bleeding is lesser, anything and everything will be there in your menstrual diary. And so you'll be able to reach your doctor early rather than late.
So, PCOS versus endometriosis, which is more harmful and why?
Endometriosis. If there's one disease, I would be, my heart sinks when I have a patient comes to me with its endometriosis. Polycystic ovary just requires a very strong diet. Just needs lifestyle change. And probably looking at disease point of view, if God is going to give me a disease which I can handle by just lifestyle change, I'll take it. But endometriosis is not such. There is nothing which is going to shake endometriosis. We'll give you drugs to decrease the size of the cyst. We'll give you drugs to make the pain less. We got surgeries to decrease the cyst. We have surgeries to decrease the pain. But it's not permanent. It's going to come back. Till she attains menopause, it's going to come back. So endometriosis is a real problem. And again, that menstrual diary would really help. So if a lady is having periods which are very, very painful, or it's getting worse with time, and she's documenting it, she'll probably able to come to us early, so we can catch the problem very, very early. But yeah, endometriosis is far worse a disease because it affects her whole life. Every period is going to be miserably painful. Bleeding can be more, difficulty to have pregnancies in the future, and a whole lot of problems which come with endometriosis.
So, does diet help endometriosis?
No, and there is marginal benefits of diet in endometriosis. We know that endometriosis, fibroids, adenomyosis, all are related to estrogen. And the amount of fat a girl has on her body produces more estrogen. So fat, actually peripheral fat, produces estrogen. There's something which we know. So if a lady has got more fat on her body than she should, that extra fat, the extra estrogen she had, will actually feed the disease. But not necessarily. We have girls who have very, very low fat and they still have bad endometriosis.
So, what exactly is PCOS?
So polycystic ovary is an ovary where there are more number of eggs in her ovary than we expect. So typically what happens when a lady has a periods, 3 to 4 eggs get recruited, out of which one becomes large and becomes dominant, and around 13, 14, 15 day it will ovulate. So this is typically what happens. What happens to these other 3 eggs which had recruited? Well, the large follicle makes those medium follicles smaller. In polycystic ovary, what happens is all the eggs which were growing, all of them grow, but none of them really become very dominant. So with time, the ovary starts filling up with a lot of unruptured follicles. And so when we do an ultrasound, we'll see the ovaries looking larger, rounder, and far number of eggs than we should. So that's the meaning of polycystic. Poly means more, cyst means eggs and ovaries. So it's not a cyst, is not like a tumor or or something like that. It's just that normal girls, normal eggs. It's just that there are too many at one time. Now, the root cause of polycystic ovary, there are different types of polycystic ovaries, but the commonest type of polycystic ovary is lifestyle based, where the person is having far more sugar than she should. Now, this is over and above a genetic problem wherein they have what is known as insulin resistance. And we see this typically in families where the parents have diabetes. So, if you have a family history of diabetes and the girl has a little bit of a diet which has got far more carbohydrates than she requires, she's likely to get pushed into the polycystic ovary area.
So, do you see it on a rise?
Without doubt. Especially in our coastal belt in this area, with the amount of rice-based diet we have and the lack of exercise we institute in children nowadays, we are definitely seeing polycystic ovary. When we were children, I remember in my school, we had PT classes out in the sun. We used to walk to school all the time. We never had buses in my time. Now we don't have that type of exercise, and food again now at a simple, just one drop of one click, we'll get food at our home. And so the amount of food we eat is far high in carbohydrates than it's required. Our exercise levels are low. So yeah, polycystic ovary is definitely on the rise.
So, how much difference can a diet, lifestyle, and weight loss do to PCOS?
Miraculous. It's absolutely miraculous. If a lady would go on to a very correct diet, every diet is different for every particular person because we have different types of polycystic. We have the obese type and the lean one. But generally, if a lady were to see a doctor and get onto the diet and lifestyle bandwagon, she's going to remove that polycystic ovary as long as she's on her diet. But one thing is clear, she's going to have to be on that diet for the rest of her life. The minute she stops the diet, is going to come back, but she'll have control over the disease. So often we have ladies who are polycystic ovary, they're on a very strong diet, they get rid of the PCOS system, their periods are regular, the skin gets better, they're reproductively healthy, they can have children if they want to. And in between, like life, we have ups and downs. So sometimes they miss out on the diet and it comes back, but they have no control. They know they can take care of it. And they go back on a diet and they're able to wipe it out. There are drugs available for polycystic ovary, but they all work better only if we really diet. You can't supplement. You can supplement your diet with medicines, but you can't substitute.
So, when it comes to the trend of intermittent fasting, is it advisable for women with PCOS, or is it going to fire back?
So when I give a dietary advice to my patients with polycystic ovary, I don't usually include intermittent fasting. Not because it's bad, but it just makes a very difficult diet little bit more difficult. So if the diet is something which a person finds it difficult to do, they're less likely to do it. So usually I usually don't include intermittent fasting. I usually ask them to go on a very low carbohydrate diet and a very strict one. No cheats, no excuses. And they can eat good amount of food, don't be empty stomach, make it as tasty as you can, because you can't suffer a diet, And most people can get away with a PCO very well with that type of a diet. Once in a while, you'll need a girl who has to go on to intermittent as well. And would intermittent fasting help her? Yeah, actually it probably would. But it just adds an element of difficulty, and so motivation becomes a problem. So I don't think it'll backfire. No, I don't think intermittent fasting. All of us probably eat more than we should. We eat far too regularly than we should. So I think intermittent fasting, all of us actually should do.
So when it comes to PMS, is it just a hormonal issue, or is it somewhere emotionally deeply connected?
It is primarily hormonal. As a girl's periods come close, there is a change in the amount of hormones in her body. So as a period is coming close, maybe around 5 to 10 days prior to her periods, her hormone levels are changing. So like our body doesn't like change, and our body loves estrogen, the body is getting used to that change. But we know that PMS is significantly higher in women who have some background emotional issues as well. So it tends to show more in people who have some kind of emotional issues, background issues. But you can have PMS without that as well.
So when we talk about hormonal replacement therapy, is it really considerate, and for whom?
So when a lady attains menopause, complete menopause, that is 1 year complete cessation of all her periods, we call it menopause. And this is the time in her life when she does not have estrogen. Now, the body loves estrogen, the body likes estrogen. So the skin gets a little bit drier, the bones get a lot weaker, the hormonal protection a girl gets from heart disease is lost. So these are all the changes, and many more would happen to a lady during menopause. So HRT, or hormone replacement therapy, theoretically would change that back to where she was, so that she will able to take care of that transition much better. But we can't give it for a long time. There are issues with giving long-term hormone replacement. We have to be careful and monitor, because there's a slight increase in some diseases on the breast as well as in the heart when we give HRT. So just giving HRT is not good enough. We need to make sure that we're selecting the patient correctly, making sure that she knows exactly why and what are the problems which she can have. Make sure she understands all that stuff, and then she's on regular follow-up to make sure that whatever happens, the drugs we give should not cause more harm than the benefit she's getting.
So, what's your message to men understanding the life cycle of women and whatever they are going through at different stages of life?
So, I get called to schools often to give reproductive health education. And what I've seen often in many schools is that they segregate the girls from the boys. And they'll say, okay, the boys get separate talk and the girls get separate talk. And actually, that's wrong. We need to get the girls and boys together so each one knows each one else's reproductive health concerns. Because a girl should know a boy very well, and a boy should know a girl's health very, very well. Because that really, really gives boys a clear understanding. If a boy doesn't know what a girl is going through during her periods, if a boy doesn't understand what a girl is going through in that PMS period, if a boy doesn't understand what a girl is going through pregnancy and the strains and stresses of that, then he becomes a lesser of a partner, isn't it? So men need to be very much part and parcel of the whole women's reproductive health journey. And I really enjoy it when my patients' husbands come with me right through the journey of all their health concerns. I insist on my patients' husbands being with me through the delivery process, and it's always fun it's enjoyable to watch the husband's reaction when he sees his child being born for the first time. So it's very rewarding again. And all my patients' husbands come back and tell me that they were really thankful for given that the opportunity to be there when they birth their child.
So, when it comes to menopause, how do you see it for women's mental health and physical health?
So, the main effect of menopause on a woman is on her bone density. And it's very important that she takes care of her bone density well in advance of her attaining menopause. Because once we hit 35, 45, the bone density is decreasing whatever happens. So it's very important that by the time a lady hits 35, 45, she builds up a bone density so high that when she hits menopause, her bone density will, even though it's decreasing, she will not have the fractures which a lady will suffer when she grows much older. So this is the main problem of menopause. The biggest headache of menopause is bone density loss. We have ways to help in that as well. So exercise, estrogen, supplementation, we have vitamin D supplementations, we have something known as SERMs where we give them drugs to help the bone density. But still, there's nothing like building up a girl's bone density before she hits menopause. So 35 to 45 is what we call the lost decade if we don't do it. So 35 to 45, a girl needs to take care of her health far more than what she did afterwards. But menopause per se is more mental. It's a transition, isn't it? If you look at a young 10-year-old girl who doesn't have estrogen, she's not yet attained puberty. And if you look at a 60-year-old lady who has no estrogen, there's no difference between the two. It's just that that girl who was 10 years old doesn't know what estrogen was all about. And the lady who was 60 knew what was estrogen, and therefore the body is used to it. So a lot of it is acclimatization, getting their mind used to the fact that menopause is not a disease, and adapting to that new change. And self-help groups, community talks, having ladies of the same age group set together, positive type of mentalities really help a lady go through her menopausal time. And then, of course, we give them calcium tablets. We expect them to do weight training exercises. We want them to get sunlight.
So, what's your opinion on these days? People are self-diagnosing themselves on Google and then coming to you. Is it getting better or worse?
Google is available at our fingertips. And so it would be unreasonable for me to expect that if a patient would see a report and not first Google and come and see me. So that's become standard. Nearly every patient would always probably read up a bit before coming. And I don't think there's anything wrong in that. I would do the same thing. Reading up and coming to a doctor probably has its own positives as well. My concern is when people action on that knowledge. So if a lady were to read up and then start treating or not treating themselves based on knowledge gained from Google, that would be probably dangerous. You take all the information you want from Google, no issues. Come to your doctor and let us action on your problem rather than you self-action on your own knowledge gains through Google. So Google is fine, nothing wrong with it.
So, is it necessary to meet a doctor when a couple is planning to conceive?
So that's what we call the most important checkup of a pregnancy. So surprisingly, the most important checkup of pregnancy is when she's not pregnant. So we call it a pre-pregnancy or a pre-conceptional counseling. So what we do is when they come along, telling doctor we plan to plan a pregnancy next few months. We explain to them reproductive health. We explain to them the fertile cycles. We get them to get a little fitter, because if you can be fit pre-pregnancy, there's nothing like it. And we put any dietary modifications we need to. We start on them on a B3, that is a folic acid tablet, which is very important vitamin for a lady who plans to conceive. We do a cursory physical examination to ensure that she doesn't have any medical conditions which come in the way of her conceiving. And we do blood tests as well to confirm that her hemoglobin is fine, her sugars are all right, thyroid is fine. So we check all these things, urine infection. So there are some pre-pregnancy checks, blood group for that matter. Everything is tested so that we start our pregnancy on the best foot. The last thing we want to do is have a lady who comes to us already pregnant and then find out that she has something wrong with her health-wise, and then try to correct it while she is pregnant. So this is not ideal scenario. It happens often enough, especially if the pregnancy is not planned. But ideally, yes, the best checkup is always pre-pregnancy check.
So what are some of the diet tips for a couple who is trying to conceive?
So there is no specific diet which is pro-pregnancy, okay? Again, depends on the diet she is having before. So when we think about diet, we all want to know what diet are you having now, and do we need to change that diet? So if a lady is having a diet who is having too much of carbohydrate in a diet, we'll try to limit that down. So we'll try to create a more balance for that particular person. There's no diet itself which is very specific to enhance fertility. But in a given scenario, suppose we have a lady who is overweight, she'll have to lose weight. If a lady is having lesser amount of muscle on the body, she'll have to add more protein and maybe do some weight training exercise. If she has polycystic ovary, then we have a different diet for that itself. So that will all be discussed in a pre-pregnancy check.
So what does a balanced pregnancy diet look like?
So pregnancy is like a river, it has different phases. So the first 3 months of a pregnancy, the pregnancy doesn't need any food. The baby gets all of its food from its yolk sac. So there's something like you have an egg, you have a yolk inside it. Our baby has a yolk sac, from which the food is going to the baby. So to help you through that period, nature has given us nausea and vomiting, basically telling you don't eat. Now, we are incredibly intelligent creatures, so we take anti-vomiting tablet and eat. But nature doesn't want us to eat in the first 3 months, because baby is getting all the food it requires from its yolk sac. So the first 3 months, all we want is she should be eating safe. So this is not the time to go and eat your local pani puri place or uncooked street food, processed food. We want to avoid those foods which have potentially toxins in them or infections in them. But there's no nutritional requirement. And this is important to realize, because there's a lot of social pressure saying, oh, you're pregnant, you need to eat better. You need to eat more because now you're pregnant. Not really necessary. First 3 months, there's no food requirement. The middle 3 months onwards, the nausea vomiting goes away. And now she has to prepare for her the growth of her child. So that's where she has to focus on a lot of vegetables. Because vegetables, that is above the ground vegetables, they contain all the minerals, they contain the fiber, they contain the vitamins which we require, elements we need for our baby's growth. And we need to add a little bit of protein onto it because ultimately our body is made only of those two elements, that is protein and minerals. And the last 3 months, what happens is the stomach, the uterus gets really big. So the stomach capacity is dropped. So she's going to have to change her food from large meals to very, very small meals because there's no capacity. So small meals multiple times, but every meal has to be quality. So we're looking at a lot of protein and vegetables in the diet. Cut down carbohydrates as much as possible because nowadays this diabetes during pregnancy rates are going up a lot. Avoid sugars. Generally, we don't want women in pregnancy to eat a lot of sugars. Though culturally, that's what's done. If you see Simanta functions and all, everyone is giving you sugar. Probably not a very good idea. And just cut out sugars and small meals. Most of this dietary advice we see in social concerns is because of a lack of understanding. I mean, for example, a 9-month pregnancy, a 40-week pregnancy, a baby is around 3 kg, isn't it? At halfway mark, at 20 weeks, if I ask an average girl what would be the average weight of a baby at 5 months, if you have a 3 kg baby at 9 months, at 20 weeks, that's halfway, what is the baby's weight? The average understanding is going to be 1.5 kg, isn't it? But it's only 300 grams. So, for this first 7 months of our pregnancy, our baby is only putting on 1 kg. So if 7 months baby is putting on 1 kg, the remaining 2 kg is happening only in the 8th and 9th month. So why are we eating a lot of food in the first 5 months? So people don't understand this. They assume that the baby's weight is linear. It's not. It's an exponential growth phase. So the amount of food we require in the first 5 months is nothing. The body will take care of it. So all we look at is keep yourself comfortable, look at quality foods, make sure that the food is not dangerous in any sense, but enjoy yourself. The food requirements, that is the weight put on, is all going to be happening only in the latter half of the pregnancy.
So some food tips which you could give women throughout their body and throughout their life to maintain good lifestyle or to remain healthy or to take care of their reproductive health.
So again, coming down to the same problem of excess carbohydrates in present day diet, especially in our coastal areas, we are primarily rice eaters. And so that's a lot of carbohydrates. So earlier days, everyone was working very, very hard. We used to be agriculturists. We used to be walking everywhere. There's a lot of manual labor involved in everything we used to do. That's not there, and except for certain subsects of people. Vast majority of us don't have that kind of physical activity which our great-grandparents used to have. But our food is excess than what our great-grandparents used to have. So we need to balance our activity, what we are doing, with the food we eating. So there's no standard balanced diet. We balance a diet for a particular person's activity, for their body habitus, for their particular genetics, and their requirements also. So for example, a person who's looking at getting pregnant, her diet has to be primarily low carb with a lot of vegetables and protein. A person who is doing long distance running, doing a lot of exercise, would require more carbohydrates than that stuff. A person who's doing bodybuilding or trying to put on muscle mass has to increase their protein in there. And so diet is not standard. It goes as per the particular person's requirements. So a check with a nutritionist or check with your doctor to check what is your diet would be very helpful.
So let's start a rapid fire and some myth buster questions. C-sections are an easy way out.
No, absolutely no. So for those people who do cesarean sections and see our patients, cesarean section is anything but the easy way out. The girl is going through a surgery, anesthesia, getting a tummy, abdomen cut, her uterus get all stitched back. So she's putting her life on the line. She's putting her body on the line for her baby. And I would never think that a lady who's having a cesarean section is doing the easy way out. She is doing what a mother does. She puts her life on the line for her child. And she's actually sacrificing far more than a lady who's going through labor, because labor and natural delivery is basically what nature is designing you to do. So a lady who's having a cesarean section is actually putting extra on the line, and definitely not an easy way out.
So if you carry a baby high, it's a baby girl, and if you carry a baby low, it's a baby boy.
Okay, that's a lot of fun. Okay, everyone loves to see a lady from far and decide what is the baby's weight. Is the baby growing well? Is it a boy or a girl? And so these are fun topics of discussion. Usually people put bets on this and all that stuff. But there is no way you can check whether a baby is a boy or a girl by looking at the way an abdomen is, a tummy is placed.
You can't exercise during pregnancy.
So this is something which has come up recently, because if you go onto social media and all, you'll find a lot of women in pregnancy doing all sorts of gym exercises, running marathons. Um, the problem here is that I get this question a lot: can I exercise in pregnancy? So what I ask my patients to do is, you do all your exercises before you get pregnant. So you go to a gym or you do all your running exercises before you actually conceive. Get your fitness really well top end before you actually conceive. And during pregnancy, you do whatever exercises you did pre-pregnancy, but within your limitations. If a lady who never has ever attended the gym, never done long distance running, I really don't think it makes sense for her to do it for the first time during pregnancy, because her body is just getting used to a pregnancy. Now you have to make it getting used to exercise as well. Probably not a very good thing to do.
So, heartburns during pregnancy. They say that the baby has a lot of hair. Is that a myth or a fact?
Very much a myth. Hair of a baby is going to be dependent on the child's genetic makeup, and nothing to do with the mother's heartburn. Every woman during pregnancy would be having heartburn. It's part and parcel of the hormonal change she's having. Some of the hormones of a pregnancy, which keeps her uterus soft and safe for her baby, is the same hormone which is causing food to reflux up. And you'll hardly come across a lady who in pregnancy who does not have heartburn.
Labor pain can be avoided totally by breathing techniques.
It can be decreased. Totally, no. There is a particular technique called Lamatse technique, wherein a lady would be focusing on breathing, and we do it as well. And so she's focusing, putting all her attention towards her breathing technique. And we need to practice this pre-pregnancy, during pregnancy and during childbirth. So this, to some extent, it's a distraction from the pain she has. And so the doctor, the nursing staff, her husband who's by her side, all of them take part in this exercise of breathing. The patients would be less aware of her pain. So would it decrease totally? No, it doesn't work out like that. We have better methods to take care of pain totally, but breathing exercises definitely help, no doubt about it.
One moment to describe the moment of the childbirth.
Goosebumps. It's awe.
Most challenging trimester to change.
It's the first trimester. So the first trimester is when a lady is changing from not pregnant to pregnant. Lot of strain, stresses involved in that. Nausea, vomiting, and all the discomforts will go, and all the apprehension she's going to be having. So that probably of all the 3 trimesters, the first trimester is the most challenging. But in the last trimester, she's got a whole lot of worries about her childbirth. Locally, everyone goes and tells her, "Oh, hope you have a natural delivery," so that puts unnecessary pressure on the girl. Some olden days they used to tell her, "Hope you have a boy," and so that again puts a lot of pressure on her from there as well. So all that stuff is going to be there. So I suppose first and last trimester is the challenging ones. The middle trimester is generally considered to be a little bit of a calm trimester.
Private practice or hospital work, which is more tough?
Private practice is far more difficult than hospital. Hospital practice involves usually a team. So you'll have a hierarchy of doctors, and so suppose you're not well or you need to go on leave, there'll be someone to take care of the patient. Whereas from a private practice, it's everything on me. But it's far more rewarding, and patients love it as well, because they'll be seeing me right through her pregnancy and through her delivery, after delivery as well. So they have a one-point doctor who would be there right through. So patients enjoy a private practice, doctors enjoy a private practice, but it's far more challenging.
Night duty stories, exciting or exhausting?
Exciting. All the fun in my job happens at night. 3 o'clock in the morning is a time when babies love coming into this world. The still of the night, they call it. That's when babies come. And when I get a call at 1 o'clock in the morning saying, "Doc, I think I'm going into labor," I'm really excited. It's a good time.
One medical myth you wish would disappear.
So there is some silly thing which when a young girl is having menstrual problems or painful periods or not having periods on time, the general advice to her is that you get married, everything will get better, which is so unfortunate because somehow we are trying to suggest that somehow getting married is going to solve problems. I don't think that's right because that puts a lot of pressure on someone to get married, thinking they're going to get married for the wrong reasons. You shouldn't get married because you're going to solve your menstrual problems, and it's not going to. There's no way marriage is going to solve menstrual problems.
So, what's one lesson that your patients have taught you?
Trust. So, one thing I've seen across my practice is that whenever a lady comes to me with a complaint, I'll always trust her. I'll always take it seriously. Uh, Often, especially I used to see it when I was a student, we used to find often, even our consultants, our teachers used to often push off patients who used to come frequently with some complaints as just attention seeking or something like that. But what I have realized over all these years is that if my patient is coming to me to tell me a problem, I'll take it seriously and I will trust that she has something which I need to solve.
Thank you. That was Dr. Deepak Shedde dropping pure wisdom and breaking down the walls. During the episode, if you felt, wait, I didn't know that, please share it with someone who needs to hear this. And for more such unfiltered conversation, do follow us. Until next time, take care of your health. Bye bye.